myself Ashutosh Padhi, final year student from MKCG Medical College, Berhampur, Odisha. I came to know about it from my seniors because they told that the author of whom the book we were reading, that author has taught itself in this platform DigiNerve. So we were all keen to know about the platform, and we subscribed to DigiNerve first time for the microbiology course of apurbasastrymicrobiology sir. It was much helpful and time saving as it is not needed to watch the lectures and read the books separately, and both the things can be done at once. The microbiology, I feel as a second year student I gave much time to pathology and pharmacology, so I was a little bit lagging in microbiology. But after I subscribed to DigiNerve Microbiology Apurbasastrymicrobiology course, I cleared all the concepts of microbiology, especially parasitology and bacteriology, which earlier I was little weak in. DigiNerve is also quite helpful in MCQ because after reading a particular topic, after watching the video and after reading the notes, it is quite important because to solve the MCQs, because nowadays all are oriented for the NEET PG exam. So DigiNerve provides the question bank in which there are MCQs, and also MCQs are discussed in between the videos as clinical cases. Video lectures are quite good and very interactive, and as I said earlier, the books and the online lectures can be covered at the same time. You just need to open the standard book which you are following and just watch the lectures, and at the same time both can be done. It is really time saving. Notes are also wonderful because they are just like the summary of the standard book which we are reading. So they are quite helpful in the revision at the end moment before the exam. The clinical case scenarios are discussed in between the video lectures also. So they are quite interactive, and they are quite like real case-based scenarios. They look like real case-based scenarios, and they are quite good. Obviously, they help the clinical case. Obviously, help me during the postings, because suppose I came to learn about a thing earlier in the video, and the same thing I watch in the wards in the form of patients. Then it is really helpful to know the concepts and to get the clarity about a particular disease. Top dog bane wahi jiska guide ho sahi.